So just break down these models for us.
Allison, well, these are the models that we have been waiting for. These are the Arizona-specific models that the state has been talking about. So one of them is the ASU and U of A model, and it's saying now that the models are shifting and that the peak for resources will now be in May. So we're talking towards the end of May, May 22nd. They're saying that the most recent baseline estimates that peak need for 600 hospital beds and 300 ICU beds, again, towards the end of May. But then they're also talking about a second model. This one is a federal model where they're working with Johns Hopkins University. And this one also reflecting Arizona-specific data, and it says that this prediction, the peak resource utilization, will occur around June 11th. So again, these are brand new models just in. Dr. Kara Christ, the state's public health director, just posting a blog. So we were notified about this because it was just posted on the internet. As you know, the stay-at-home order here in Arizona, it's set to expire in 8 days. So a lot of questions about what does this mean for Arizona in opening back up now that we have this ASU U of A model that is really specific to the data that is being tracked by officials here. Also, we're expecting to hear from the governor today. His staff has told us that there's supposed to be a press conference. We still don't have a time, but these are the models that we have been waiting for, that we have been asking for. So this is really important information to get out there right now. Garrett Archer, though, my colleague, he is the one tracking the models and the data the closest.
Right.
Garrett, what are you getting as a sense of what does this all mean with these new models?
Do we have Garrett?
Yes, I'm here.
Garrett, so Nicole just asked you really what these models are looking at, and you've been following these numbers for a while. So just kind of break this down for us from your perspective.
Sure. So the DHS is referencing two separate models that are being used to widely look at COVID-19 and its impact. One of them is the interventionist model, which is the COVID Act Now. That's the Imperial College model that's showing what would happen with no intervention and with strict shelter-in-place type interventions, as well as a curve-fitting model, which is the one used by the University of Washington. This takes a hard truth data point such as the number of deaths and then does the math backwards to figure out the hospital uses. So what we're seeing with what the DHS is at least telling us right now is it appears to be sort of a combination of both. We don't know what their methodology is just yet. The model does project 600 hospital beds and 300 ICU beds by May 22nd, which is sort of a little better than the interventionist model, but worse than the extrapolation model. So without knowing which data points they're using, until we get that information, it's difficult to know, what the model is trying to tell us as far as which data points they're using, but it seems to be at least a good mix of both.
Okay, we appreciate that perspective, Garrett. Again, just learning these new models released by the state say we have not hit our peak, and that may not happen until the end of May. So Nicole Grigg, Garrett Archer, we appreciate you pushing for answers here and just really offering us that perspective. So we, of course, are going to continue to analyze these new figures. We'll have a complete report and breakdown today on ABC 15 at 4 o'clock.